At a Senate committee hearing on July 31st, Senator Warnock questioned Gustav Chiarello, who was seeking confirmation to be Assistant Secretary for Financial Resources at the Department of HHS, about whether or not cuts to the CDC could be categorized as waste, fraud, and abuse.
We all know that Secretary Kennedy talks a whole lot about wanting to address chronic disease, and I support that. I've seen it up close as a pastor and as a senator. But let's look at what he's done these last few months. On April 1st, Secretary Kennedy completely demolished the CDC's National Center for Chronic Disease Prevention and Health Promotion, and in the president's budget request, the center was completely zeroed out. This office ran programs at preventing Alzheimer's disease, diabetes. Let me quickly say that $1 out of 4 in our country on health care is spent on people with diabetes. It's the context for which, we see emerging disease and sickness. Heart disease, cancer. Do you think working to prevent Alzheimer's disease, prevent diabetes, when $1 out of 4 in our health system is spent on people with diabetes, does that feel like government waste to you?
Well, I answer that by saying I support Secretary Kennedy's efforts to focus on things like waste, fraud, and abuse, and also to make sure that the funds that are being allocated by Congress are getting to the people who most need them. And sometimes that involves reorganization or refocusing. And I look forward to getting into the position.
Brother Chairman, I want to thank you for giving me some extra time. And so let me just say that an ounce of prevention is worth a pound of cure. And we literally see that in the work that CDC does. And I would hope that you would look at this, that you would take it seriously, because it's literally a matter of life and death. Not to mention the implications for the federal budget.
For more clips like this, stay tuned to Congress Clips. And thanks for watching.